fiti anɔpa bambɔ ne nhwɛso pa wahwɛ na nwumre nso odi aba w'anim ha wodi na asedanka na wodi na yeye nka Awurade yɛpɛ sɛ yɛserɛw akoma mu bɔne ne adwene mu bɔne yɛserɛw na ɔde ne nyinaa kyɛ nwumre ama ɔsom yi atumi aduru w'anim yɛpɛ sɛ yɛserɛw na yɛde w'abaawa nso hyɛ wo nsa nnɛ wona wama ho kwan sɛ wɔnni dwumadie yi mu o yɛserɛw nkyerɛkyerɛ a wɔbɛkyerɛkyerɛ yɛn nyinaa no Awurade wo din mu nti kasa fa ne mu na yɛntumi mfa w'asɛm baako biara nso nyɛ adwuma o Awurade wo so na yɛn ani da boa yɛn nso a yɛtie no yɛntumi mfa asɛm no nyɛ nea wo Awurade wopɛ mesrɛ wo na adɔfoɔ ne anuanom nso a ɛtwa sɛ nwumre yɛne wɔn bɛhyia ha no a wɔn maayɛ no yɛserɛ wo kasa kyerɛ wɔn na wɔn mfa mmirika wɔn mmerɛ afidie so na boa yɛn ade nyinaa kɔ awie a yɛasa de ayɛ yie ne nanse ama wo dini yɛda wo ase paa sɛ yɛn adebɔnyɛfoɔ yi papa yesu frɛ hɔ a wotie yɛn wɔ Yesu Kristo wo din mu nti amen
Yɛmɛde wɔ nanka mɛsrɛ sɛ nka yɛnnua mo mmaa ne maame nyinaa wɔ ha nka ɛyɛ paa but sɛ ɔmo nyinaa ni ha nso a ɛnim sɛ mmerɛ no nti yɛbɛhyɛ ase me nua baa ma mesrɛ sɛ woayɛ krado a ɛkwan da hɔ sɛ wobɛdi asafo no anim ɛwɔ nkyerɛkyerɛ no mu Awurade nka ho amen
Medawasi bebree Raymond Nyame nhyira for the wonderful introduction. Ebusa for me chawo bibia I hope some of me na mote me nkan so.
Iba try to nka.
Yeah, the Nyame ase. Me person me share me screen abra ye bedi dwuma no. Raymond why ade me akra na me hu kwan ka me fa so akyerɛ I can say pregnancy and oral health care e wo twi mu. But watch him we pa ti medawasi bebree for that. Before that, na say wabompa yenti yenko empire bobia so yedane wuso ase for leading us in the prayers. Yes, baby about kuni mienu ehye bia nyame wo ho. Enti it doesn't matter say endorse. Once one of us know the message no, it can be spread for many to know. You bet me da kwachi because you want your mama, your mommy, your papa, and it looks like the focus is just for a man, but yeshishemu kakra mema ne mfalane obibia me can say is the message for all of us. ATV Bible share my screen so that we go on to today's topic. Yeah. Oops, I'm doing the right thing. But you'll be on my screen, oh. Yeah, I'm just going to start this slideshow and then we go on. We do have a say be a moon who I'm sure not mama men who why not yet me. I am yes, dental care during pregnancy. During pregnancy, it didn't here pass say a brian yemuno, yes, say a bo ye num a hope I am say any coon ye num ho apomodin. Yeah, what say well, yario, yenny yario, yenyumo, we still have to take care of our teeth and gums. And I say, I see a boy, ye num ne, ye some who buy. But a bra, ye benyamono, I say a yano, bebre. It's so no, you ho sister, na be never go honoma. Ya na, make an say, ye mieni nko and I found a tra. Because ebia yenye mbako no saa na ba yenye mienu saa na ba ye enti I feel say enye problem but ye ko ye nim no ye behu say eye problem and because say wonye mo a wonye ma e wo nipadua mu nyina no nso no e brase ana say hormonal changes enti no ema enema edi nsakrai kakra ba wanum enti wonye mo so a ehu hia pa say bema wanum wani akọ wanum apomodin ho eti bisa me ho anase me de ato se adenti na ehia why does oral health matters to pregnant women? Yedikaka, due to hormonal changes in tea, who here pass over board would no, and they was some by us when it when no aholdeno, Obama when ni apostle. About 60 to 75% of pregnant women, really be a friend of gingivitis. Gingivitis no gum disease. Gum disease na ye will more stages bebree na deɛ na bɛmu ahu sɛ wonyim no wo wɔ saa yare na anaasɛ waduru mpɛmpɛnsoɔ a ɛyɛ sɛ wokɔhwɛ w'anum yare anaasɛ w'ani ɛkɔ saa yare no ho sɛ wonyim a hormonal changes n'akyi no anaasɛ nneɛma ɛsesa wɔ nipadua no mu no wɔse obi wɔ hɔnom a ɔse menye me ba baako anaasɛ me ba pani no mesi tui anaasɛ ebia ɛna menya ɛsen problem. These are some of the problems that obetumi enya ana obehia abra a wonyem. Hormonal effect affects increased tooth mobility. We see betumi akeka ba energy say no say oh ya no ɛsen no tumi sa ba back to normal. Ɛna wo saliva changes nso ebia bɛyɛ bebree anaasɛ ɛso ɛbɛte. Say eye bebre a enka hydrogen because saliva and intestinal kasa no e wodwumadi a edie e wo yanum na bra eso betie no ene ya na ede ohaw kakra ebre ye nipadua na say yanum ena afei bacteria na e wo yanum no nso e bedoso yi na enim so bia wo bacteria good and bad a e bo ye ho ban enti abra e doso na wonya yare ahodo a ye friend gum problems and I say gum disease no enti again now wodi behu ana say gum disease crampo se menya again na eye me se mewo me bana se mesino ana menum ahoden baba back to normal ene hu hia me say me bo me se ho bana se me ma mani ko me se apomuden hu emprempi no se wan ma wani anko wo se apomuden hu ana wanum apomuden abra wonyim na. These are some of the problems that ubetimi eshia. Ebi mpo obetima wo ba no premature. And asa obe wo no na oba no ni weight no a esenka oba no. Waye kete. Aha. Eti some of the complications that ubetimi enya. Ebi ni yare a mebubo obo so yinso second problems no ubetimi enya ebi a wo akwara no krampo na emfiri ho na ba beka ehonum. Eti ehu hia pa se abra wonyim no anase wafa efro no obefma wani akọ osin apomden hu na wonum no a ewo honum no sei bia hu bibi wonum sanity a ebede no hu say yare a ye keken ana say complications bi ewo ho me pesa wo fa adaji mi ni say bebre ni bi kra ho nyem ana ma wo awie but say ye wo ho a ye ni ye each other fan say ye know we are angels to each other. And me use the word, but it's not coming. We helping each other, no. Ubetima mwani ako wadamfo bi hu nua bi hu. Hwa wo hwa esen a wosori ne de wofom bi a empompo bi timi bo esen ne bi a entem ye frɛ ne epilepsy and as a pregnancy tumor. Se eba enye ya but won say aye kokɔ odu brush kɔ a na afei free moja. Esen nyina enam na wosen no ho no ebetimi aye puff and I say mremre bokom esen first ne said na wosi ehu wosen and I say wanum and I wonu adua na onyim ye no said na ne num esitie enti we sa esen tamo say sometimes there wo animu no ekọ akire na bia between 1 2 3 no and I bet me say kompon aboho and I say a form de no abo eho no one kasa wo hu a unhu enye wo yakra enti bia befa no normal because nyinsa na kasa na ede bia emreye bia brown ti adaje crowd ko onim no na de hwa hwehwe mu kra mpo no unhu and what me amoni akọ ehu. These are some of the things in tia yakasa bia ma wani ko wapom de wanasa bra wonyim no obehwe na watimi aye nsakraye enti pregnancy gingivitis na kasa yare ba wonyim a eye more and I say etimi ba etimi ba Emrika so na say one kasa na ewo wo ho a ekwan beres na obefa obehu gum disease no se wo hwe wo se a se ese ni nyina gina ho kama ba enam no ayemre aha I say red inflammation bibi kitwa bi kan no na promoja so the brush yo so wo di aduane hye wonu mu se wo dam paso bonse prempi ba sorry na upilo no na emoja ayedai akom and some of these things na who because oh menye me no and menya pregnancy gingivitis because one nyema ubetime nya but se wonyema na woni akon se de na meye afa ho ye koye nim no ubehu it must have another picture aba see a shot because we will have stages of gum disease so number 1 year healthy teeth and gums and I say healthy gums and tooth ejina ho esini jina ho kama and nam na was saying ho nyina jina ho bibia and hygiene ba picture 2 na first stage of gum disease which we call it gingivitis na we who say esini nam no ase a free esini ho ankasa and esini no ye color yellow bill say brown bisa aha over the third one now, which is progressing, no, your friend, no, periodontitis. And no shan tell me, I won't say, as a pocket be, I bet that gum, no, any essay, no, essay, no, every gum, no, a drew San Maria bone destruction because essay, no, and now no akata nkasa essay, na nkasa so. Ye joy nyina ye nkase na ese no esi so ba enam se ye hu nti ye nhye de hu ohawa ya na ekọ ase enti udru ha sei na bu na afebon se ese ni sis no ewu anase eyemre nti usini si hu anase esa dance aha udru the fourth stage dia ye ntimi nya ho hwe bia na akwakodru se ye betu ama enti majority na me hu wo manase make say omonyema omunya ohaw no star stage we no udru a ye betu anabeka cho se wo abofra na bra na ye ntu nti ehu hia pa se wonyem ana wonyem a wobema wani akọ wosen ene enam anase wanum apomden ehu for oral health sign and symptoms then na one kasa no bia wo ye bema wonyem ye then na ntibidi abeshem for ye nyina general like I have said no bleeding gums enye healthy esia eti akwa yare nim no it should not bleed aha afebon say bi kra wo de moja ma wo ba wo ho a wonya pain wo ho na say wo yaw bi eba wo sen enum ne wo sen enam ne ho woka bibi te say apple mu a wo say na eye wo ya nti any direct biting no wo say na eye wo ya afei so wo say sorry a sometimes we fono and I say inside your cheeks no etime hono na asa adwojo na hono na adwojo ebi nso wo ho no ma wonya the first 3 a yaken but obetima benya bad breath enuka your friend halitosis aha eno ni nyina e sign e show say wonum no entiapo entitu anamon bi efa wonum ehun you can't lose teeth and I say lose tooth aha wo se ebetimi ahinhim ana ebekeka emu abonsa ye den kakra emu abonsa sa ye mre ni nyina e show say yare bi ekọ esen no emu ana say wonum collection of pus under your gum enti won say sometimes so wonhu enuka ene esen him ba won sa eka obi a wabodwe kra won say ensufin bi etimi free ho ba ne scent enye kra eno nyina show say there's a problem in your mouth and let's look at the picture underneath picture that's saying the any yaren which is highlighted as green no healthy gums no wosha esini na your white kama and now no sisi hobby bia ni ho but when it comes to the left side now gum disease has started and we have be arrows no air point here e ho no started yemre efin aba be hihye honum e de yare ba wanum nti this is a message for all of us inye yinkwa apemfo nkwa na so na wafefro again apart from tooth gum disease no yewo yare be a friend tooth decay na yana emprempi ni yemma no ene ya neta how but obi bia betimi enya sa yare we ekwan be so na ye fa so enya eye sichire ene de ba first problem which is gum disease na majority no ya na ye yem penifoi na momonyem a na aba ba ye more eno no say ni so sorry no antwitwe wo se a imprenu a ene edeba and this is the stage say wo se ebenya tokro ewo ni ewo a bacteria like I've already mentioned no you good and bad and it started wodi bibia esichire wo mbia no biscuit cereal drinks, juices, the entire animal no fie no ana tea crana the sugar guma samre no bacteria na sorry the bad ones no aba be attack sugar no ana carbohydrates no refined one no na fe aba be bi to say acid satan wonum entesu no abre ase ekofom enti bon say bacteria na enya hoden no wa turn sugar na into acid na fe eba beko etia wo se eno ho enti se wan twen ama 20 minutes amba ansan we de si kire aduane a obon se ho no na esen no enamel no de we yendum white ni say no a epie ma ye hu no ene e friend enamel no na ene wosano beko bacteria na turn to acid very esen ho eho na se wan hwe na se wan hu time se wudi asichire no ante asichire aduane so a na afe tokro beda wosim na edru ho no ma bia yentimi enya ho hwe na akoba se tu na yetu ana se bacteria no betime didi afri wosinum akwase ho na afa akwakosei kasena esinisis no na afe tu na ese de etu this problem no wonyimo etimi ba wo ba wo be mo etimi ba wo panimu wo akwara wo but majority no mofra no because omna ya na pe doko aduane enti and also any risk factors for tooth decay include ebina makeka dadano high content in sugar and I say is aduane edia esi chire bebre egum baby a wotie ebitima ye factor Manchester has say ye can enkwala omo and as me fan say UK ye rate enkwara omo poor oral health Manchester eka ho bi ye ni kan a ye ka ho previous years in na ye dikan because yensuo no ye will be a friend of fluoride and I say fluoridated water ye ne cancel no akon say ye mpe bibi te say fluoride ebeko yensuo encrobit say Birmingham and London Essex omutimi je sa fluoride nugu omunsuo enti ye kan kwara omo esen papa eti apo ana low a friend is say cavity rate Birmingham kwara etoso etope na Essex ne nkro akakra na te se omafne cancel no edi nkomo a omaji atumo no enti ba bia wote ne eka ho na poor oral hygiene ebi ni say wo sori a wontwetwe wo se wetwe wo se kra na tena wo ho ntwetwe wo se ye wo gina ho bia 1 minute no twetwe wo se ana 45 seconds ana say wontwetwe ne mprenu and spend 2 minutes ayanopa ene enwumre na ese wo ye wonfa toothbrush papa edwetwe wo se emrika so na de ko na watwetwe awie no nso no wonpe bibitsa floss ana interdental brushes and find you will see these are some of the things that ma carry be say poor oral hygiene just wonfa wonum ho and answer the didi na woko yana meme them the examples ha me pa especially ma woman's who are dressing it ho kama and a shoe 50 pounds, 100 pounds, or better, ashe, atadie, or better, I look good. And when it comes to the mouth health, or faho cry, and also na AD, because ansana, the pediatric basis is so, I'm more about life, I'm more be any ajo hono. If I were new, and you need to take good care of your mouth and at a tea. Now, when your saliva is reduced, so the flow of the saliva reduced, and also ubetmenya a senho how, and enquire. Akwara bi wo ho no ma omaami ani nkɔ ne ho de papa ani nkɔ ne ho ɛna madwuma sam ana bibinti akwara no no akɔhyɛ bathroom ade onim na ɔyɛ enti sometimes nkwara ne bebre no ɛwɔ cavities ɛwɔ onsim we were all older adults yem papa mo ye nananom ye maame mo gu care home no ɔmo nso again obi a yare bi nti ne nsakra na emu agogo and I say adwene no crampo eni ho papa enti wonim de oye carers no so enim de omoye and I say omokro omo nye ne papa enti people like this no omo so betimenya or how ewo omo sin ehum and not taking care of your teeth. Like I said, no, bibia won yare, tiapo, adrenum, but kana on famu, menya or how consume too many sugary or starchy food and drinks, no, and also bit mama or how about no having dry mouth, it has a dry mouth, and no one I'm there, Baba Shas, I said, xerostomia, the correct term, no, and no, be an out there drobi so and no bit to say I'm not open high blood pressure and no any epilepsy and no any yare bebre and no na yedema it's me reduce the amount of saliva isn't a free yenum eban. Some people like cancer patients no more oral cancer, not just maybe any part of the body and as any organ in the body, especially mouth. No, almost me had dry mouth. And now when you cancer, no radiotherapy and I say other treatment, no, and it's me reduce the amount of saliva flow. And when that happens now, you can get all these kind of problem. And then you want crophobia or more disorder, bulimia for anorexia. They want to stay fit, and I said they want to stay slim. And see, aduane kɔ n'anum na wɔde ne nsa wɔ n'anum na aduane no pii. Saa nkurɔfoɔ no, wɔn produce too much acid, and that's too many acid from the stomach. It's me for almost no ho every epra. Obo nso a ɛnyɛ so ɔno a na pɛ sɛ o stay slim. Obo wɔ hɔ a ne disorder no n'adwene ɛma no ntumi ne di. Something is telling nipadua say aduane is not good for nipadua na say for no it will also no aduane ko n'anum ano say eba ebi say yare he or she is willing to eat but odru hɔ a na body no pushi aba it the amount of time acid is coming in contact with the teeth no you can get all this problem like gum disease or tooth decay. These are some of the risk factors with me. So now we go back to our main topic, which we say pregnancy and oral care. Diet matters, and I say we did ye. Again, me and now bit me did duty craving. On say more for a frope no. Ba much be dear Johnny be and tentem so be or crampona and miana ebia ka wo nyaman ka wo ni no ene na ubedi. Enti anytime a wo didi saa nnuane bebree no na ede ohaw eba wanum ana wonfa emre entoto ho no na ede ohaw eba wanum enti that is some of the suggestion make they at all say o person wo didi yes is good but ya no reduce the sugar content ebia wofa apple ebia 8 o'clock and come do na person you are allowed to eat cake or biscuit or sugary food but make sure say 30 minutes about and an hour about and 2 hours about so that the amount of saliva no has come to the top where ebema was no ejina baby se bacteria bonene kra eba ontimi emefa or how bia ento was in so pencil where the apple you can jump the cake or the sweet food there is banana, there's orange, bit me a DB and also bit me snacking on something like a chocolate. But ideally, some of these food, as we all know, you can eat them. Ebe boa ni peduana, ebe boa wanum, ebe boa akwala na wache ye funumu no. Because mind you, first slide ni ma ye say, yarena ewo yensu no na say ye yanyem na aba yensu no. It's not just as heti the inborn akorana ye be wona to abontinity before so be wa akorana no na wam na develop cavities and san e bi kra wo because the same every no e develop wo ye fununu and it's not just you think about akorana so wo share ye fununu and so these are some of the guide as previously we have already talked about. Ede na obeye ama wosen ate apo ye di ka bobi so nti eno ani wo sora no pa no twitwi wo simpre no. My message is always going to be the same because it's an oral health talk Enti a sugar ebe si twhwe. Enti what in bebre na don't let it say be ebe ball because there's nothing I can tell you apart from this. And now way so you save yourself so much time and money because you wouldn't know the problem and I say how much it costs until you get a problem. A bus you go £2,000 for a same back show and that is really true. Ebi I was saying etu echira. What's that? Yeah, and you don't really care. But ebe tu ewe anim one share masker. Na just untimi syringe obia. And to have a treatment for it, the cheapest crumple will not cost you anything less than £300, 300 and apples. And yes, say yeah, the same message, and you do the same thing, you save yourself a lot of time and a lot of money. Maybe you may have the money to treat your teeth and gums, but think about the amount of time. Time a dental appointment because yenye procedure bia ba ko se wura mu ano ne fix so. Some procedure could take about a month, 2 months, a week and plus. These are all costly. By doing this tiny thing, using interdental brushes, which edahano, any floss and cleaning your tongue, will save you a whole lot of money and time. And when you are happy, your teeth is also happy. And as when your teeth is happier, one kasa no wants to because what me the kama, what me sre, was saying oh yeah. Luckily and thankfully, na me bompa is me sing me that I've not experienced a senior 80 minutes, but the people I see, when they come, boy, nice pa. But the senior no what I said. What Cassandra Hono, one mouth Cassa and Tietia moi. One hair crown and so throne or day bema, and I said, or because and beer, ububefu. But I know not, but because of a jow now, war common. And yes, when your teeth is happy, you are also happy. And we are to do a lot for youngster. Yeah, nipedia, a boy. Flossing, a lot of people don't know how to do it, which means that a very difficult. There are so many YouTube channels and videos that what YouTube you can watch and see how floss and kasa you use no floss ni a good pa a boy Mr. Minko use any thread some maybe and I'm saying the floss ni saying you could use floss has actually been designed for teeth and gums because what you choose previously we have talked about this, so I'm not going to dwell on it so much. Excuse me. Brush, as we know, yes, and 10 times in raho. And floss in the baboy ye and num any near question hono. Nothing and can be on my day a year free hono. So it means you floss now, interdental brushes, which is great, smaller brushes, beer. Way dentist has to select it for you because uniquely, we all have been created differently. And you're sending them a BDS so a BDA, a BDA tre. And to fa kakrake ya to ya. Maybe I was saying them you are going to harm your gums. And I was saying them no so tete. Na kofa ya, you are not doing yourself any great job. And see some person use interdental brushes, which is very good and easy to use now. Then you have to see a professional, dental health professional, to choose the right size for you. It comes in a pack of maybe 12 or 12 for a price of 200, sorry, for a price of £2.50. Abrozan £3.50. You can use a single brush, say for about 2 weeks. And sign what actually, and see, you will save yourself a lot of money. Now, one who say you choose you can use it once a day. Same as floss, you can use it once a day. And one ube choosy, sanopa choosing then you floss. And as you use your interdental brushes, that is fine enough. So upon a rush, you can also do it at night before so and pass you can do that. So you can choose a timer. With it. And again, I've brought a tongue cleaner here. Tongue cleaner, it comes in a twin pack. Sainsbury's, Super Drug, Boots, all the supermarket shops and drugstores, it will be. Or dental session. Yeah, and the board for cry, a beer 99p, less than £1. Woody, before catching us, when you choose, then you just go down your tongue. Wouldn't it be now corner na rebe feeding na ferry so be so be say mo che me tongue cleaner na the toothbrush na no na ukitwi wo sin wi a na what dia fa ketre maso so nice be yi bibia e was enka bia e dey every so amount enkwala ya wo mo ni sin no obeti the cotton wool and I say we tongue cleaner but the share nsa obeti when you be wo Amazon it comes in a pack of plenty for a very cheap price now the afefa akra no ne sene nam ne ho ene ne ketrema so ene so beboa efin bia because say bia oni sin ontimi fa toothbrush no akopra no enkwara toothbrush which is very soft but e bia akwara no on ma kwan e ma wonye but unso ntimi nja no sa so some of this cotton wool run I say gauze or the found someone now the toothpaste kakra bi ato so the be fa akra no apomden ebeba nenum and I say ni pedum dental treatment during pregnancy na on say nyama yenije ye wo adwin bi say me pese me bibia ma aha me ba no we are so attached to everything that is going on and ye tearful to bibi obeka kire bia no we want to listen and the obika bibina sebe enye doctor and I say healthcare professional futu krana and now on experience or the ma ubeti and you person obey the right thing e be so that the all can say the right thing but we are just here to talk about treatment during pregnancy so now how kakra wo sima na se wo de wunya how kra wo sima enam say nipadua no hormones ni exercise no na obenya problem nti no wo de ko dentist fa na wo sene ko kire fa nipadua no ko kire say wa fa efro na wo be so hu se bibia ye normal ana se de na wo beye ana se bia wo fa efro no se de edi ka aka no wa benya wo how wo sim ba wo so say ukofa treatment bi koka ho se ekotu sia ana ekoma injection ebeka akora no e bibi akoya akora ebe na your first baby ebe na your pension baby ebe na your baba bi a wapa ache ebe na ebe until you don't want to do anything na ebe ha me I'm here to tell you say during pregnancy no to have a dental procedure to have a dental treatment is safe. It's safe. Entema ehun bia ehye wo mu we are here see yakoba na ehun baby a wadru say bia first second or third trimester na yehu say any kwai say ye bibia we won't do it bibi say bia opesa unya implant sha wosim because to grab gaps abada ho very elective procedure enti e beka cho say makora ne mransa ne bra but bibi say cleaning with instruments dental instruments to remove plaque and calculus and everything no you bet me aye see to no you bet my injection is safe for the baby and for yourself you bet me the mawa e bet no me the area you bet to filling you bet me aye amount but filling aye amount mercury filling which we call it amalgam filling e bi no filling be aye black musim and there's an argument going on say containing mercury which mercury is not good for the body and inti satan na wonyim na wosim no bianca no there's no problem but your contralia it will create a problem for yourself and for the baby inti no the bit me dia to nchen say ebia wo dia ko wo bra nyame boa wo abofra na ba the bit me see na ma but ya ma for yaw no nko ye be yam say yaw na so how no ano be brasi inti some of these things no okwa ye betu for but don't say my minister me ko ye papa ne say that be you and yourself no take it to the professional listen to what the professional is saying then who say ebeboa and san why day why and answer the okwa wonnim kra no dentist no ontimi ma obi bia ne ho be kire no say the license ye beje enti wonya ade a ono no be chinti woni ne di nkoma ohana se beboa wa obeyama ohana se mwa onyama sometimes like I said pain can make some people make a decision bia ya na enye good decision enti obo hono ma ne se ni kwasi yetu ba ne ja no enti about tu no when we see the benefit wa you can't force us you are always there to do what we think is in your best interest and your be amount enti ne nyina no nkomodie oba ni ahwe who say your man I say but person to show trim say to have a dental procedure, even x-ray no crampono, is safe. And you don't have to suffer in silence when that time no will call Bibi Musa. And again, so when your man with 3-year NHS treatment is free for you, right from the first month of pregnancy till the end of pregnancy. So Sakran Benya 1 year no, you're free. And so why do you have to have a problem and suffer in silence when you can have all your procedures done? Because procedures done are what NHS has put there say a free mo and you be say whitening, but so see if it are there be. But Bibia NHS consider say is in your best interest, is for your health, no, you can have it for free. So one called private dentist, now called NHS and Kwandia, the government no I share mom say, Sano, ubetimi enya. Enti ehu here, so better ho. Na obeko or how ni atiti mu. Enti aha ena mede medicine no ebesi. Me pa wo show so question na ana emwa. I'm here to listen. Nyami shramo for coming. Mano esi. Midamuna mwase. Amen.
Amen. Ama yɛde wase ne bade sua a wɔde ama yɛn. Nnuanom, deɛ nuabaa de ama yɛn ni asɛmmisa na mmoa ɛfa yɛnum ahonedie ho deɛ ɛwɔ biara no bɛtumi abusa na yɛn nuabaa no aboa yɛn. Ɛkwan da hɔ obi a ɔpɛ sɛ obusa question bia. Brother nso wobɛtumi akasa wowie a na Same nso atoa so.
Bakɔdwo mpakyɛw meda ase. Sita ma mpakyɛw yɛda ase ne nkyerɛkyerɛ ade ama yɛn. Masɛbisa ne sɛ yɛsi akyi nam no yɛ gams no ɛtwa sɛ yɛtwi yɛse a ɛno nso yɛtwitwi no sɛ ne yɛtwi yɛse no anaasɛ yɛtwi yɛse awie no no ara no yɛtumi gyae no saa. Meda ase.
Brother Nyamisha, that's a very beautiful question. I'm always here with something to show as a demonstrate. Yeah. Funny say when numuni, Godwin. But in so saying, but Madame Fuediano, that's what the unity. It's what you choose, yeah. And how dream baby a person starting free, I can start from the top, can start from the bottom, can start from the left or right. You need any particular technique and I say area to start first. Me ramuna me brushing my teeth and I'm right-handed. Most of the time I start from my right side. Oh, start here, say fato 45 degrees angled. 80 mommy is brushing fresh me 45 no any what they only 45 for now. And I'm saying a sin and a gum no which is a nam no a bako a boho by me pacho ma two brush no and come home say ya chichia and also benya I think our brush no not only a fibia because they are really start here majority of the time I started from gums no and yet a sin it's the way to cheat gums now wobɛtumi anya yareɛ ɛwɔ ho enti ɛnie wode to aseɛ sɛ na aka ɛsen no ɛne gum no nyinaa no mapatwɛ manyɛ ne dendenden as we have already been shown or talk about the hair now what they call you work yourself start right from the left now to the end to the left star no akɔ top we do top it's 90 degrees. Won't me who 90 degrees are with the any just the gum and the teeth no together. Simple yes. I saw brushing teeth and gum, not just the teeth. Yes.
Same wobɛtumi ɛdo asɛmbisa na ɔmboa no ba.
Mpakyɛw stabila ɛda ase ne presentation. Masɛmbisa nie for yes no mpɛsɛ mu sɛ me who how to ask it, but says seno ningina hoɔden ɛyɛ pɛ ɛno yɛ baako ana second toothbrush na yɛde use ɛma yɛse no ɛwɔ ɛse biara ne toothbrush ne texture yɛtimi de mana na sɛ biara ne biara timi fa because sometimes we have to use brush biara timi sɛ ɛne wo sene no ɛno ma nkɔ yie saa wait my boy Hokakra. Masem be saying
Okay,
Mundaha.
Sammy, made us say, Yami Shroud. Another good question. Essence that you're in more, Ningina no ese na hoarding eyepe because it is you from head to toe. It is you. Es na hoarding in eyepe. But abra na hoarding bet me aba from ni say bia tokro beda ba kubimu enti aye feeling enti ono na ba be weaker than the rest of them. And I say beer, like we are talking about gum disease, no, infection be kwase, and inti amano ahoden aba form infection no ye treat him but and I'm say I just say would nine ebu pain on say day a bit my toy and I say bonkuno and the buye ain't me ahoden ends ni fan into unim slow sin nante efa ain't yes ne nyinaa no sɛ yare ni mu dia na hoɔden no ɛyɛ sɛ ɛyɛ pɛ but changes ne ba mu a na afei bi aba bɛyɛ weaker than the other toothbrush no yes ɛyɛ one texture of toothbrush because when ɔmo yɛ a ɔmo design sɛ bi baako sei na kita no yɛakyekyɛ mu no ɛyɛ the same one, the same bristle, the same handle, brands no dose. What we recommend as dental health professional is to use a softer toothbrush, which is the bristle, no, yaka softer. That is what we are talking about. And a very like firm handle, be a bit more sum. And companies of toothbrush, doors, and into your name said you'll be a medium is to softer. And to catch us use medium, maybe any harder to or no another to meno, and so they stay between soft and medium. By any of she trim say the air dino and a bit me a fin and you're running free hole and I remember missing a fita. And no, I any mistake it mean or however you so because I'm proud of one now because yeah, your habits. Even maker saying I have a habit of brushing my teeth really hard, which I'm not supposed to, but I'm telling you, my mind dream by me whole swap. Oh my God, me brushing it and then my side back. 80 so medium to soft to medium now so bakwa which make you chia ningi na an be kama bayama why dwen you say so peden den what you den go three den na wo ha gums na ye kan wasam no gums need to pull it away na ese na baso and it mean sensitivity which we call it mesefin feminti aduane be say cold or hot no you don't want to have it because what damage was in the gums no it have a toothbrush and yet very soft or medium. Now that you choose a gentle yes, you design toothbrush be bristle, but it should also be like a soft head, like a small head. With a toothbrush one, it's in the sopa. The pen, the bit me rubber numa. Impulse come on, was in this it's me and you been a measure, but electric toothbrush no, I have a motor. So what you choose it and then it's me catch no way. And I say and no is designed almost soft is soft. It is our sensitivity crampona. So what brushy baby behunu wajai. Bayana expensive. It ranges from 100 to 350 pounds plus 500. But if you do well with your toothbrush, which is the manual one, when you're the same effects than buying expensive toothbrush to brush your teeth. See, my name is my answer or question, but that would be the answer for you.
Me pacha me that's ba.
Thank you.
Ama me pa so mame musa we kakra.
Okay.
Menim sɛ yɛwo obiara na ne sen fifi a ɛyɛ fitaa. Asɛ ne ho na nipa ne yɛnyi na ɛsen no ɛsesa kala. Ɛyɛ ahodinide na yɛma ne nkɔ yi anaasɛ ɛwɔ sɛ saa na yɛsene kala ne yɛ. Ɛna obi wɔ hɔ nso a ɔmo sɛ ne sen yɛ fitaa. But wobɛhu sɛ ɛsene ɛɛkyɛngyi a ɔkɔ dentist a wɔbɛka sɛ ɔni problem biara wɔ n'anum deɛ. But wobɛhu sɛ ɛsen fitaa no ɛyɛ brown a ohunu sɛ ne nyɛ saa ne teɛ. Ɛno yɛ baako deɛ ɛdi kan no. Ɛna deɛ ɛtɔ so mmienu. Deɛ na ɛbɛba ama sɛ ɔgam no bɛhyifte ɔsene bɛfiri gam no bɛfiri ɛse no. Ɛyɛ ɛse ne etwitwi ne dendenden anaasɛ problem bi na ɛde ba. Because ɔbɛsan akɔ dentist. Ɔpɔn sɛ wɔn sɛ gam no se no ebi ɛkwan bɛda aseɛ gam no ɛpushi kakra no. Ɔbɛkɔ yɛ sɛ ɔni problem biara. Nti no ɛno nso deɛ na ɛbɛtumi ama na abasa. Medase.
Very fantastic question. Yes. Enquire from age to 0. The way I'm saying 0, my who cry won't know or I saying I want to know. And it's possible so cry 0 in the beginning, but yeah, usually from 6 months now, who's cry and see a 50. And it's seen from 0 to 12, 13, a white, a appear white. But yen no and I say 8 to 2 now and penny 4 dear no ebeshimono na yellow. The reason being said, man fat start topic we are man come show said a sin a city and is a city. Yeah, what be a friend dentine, which is inside the tooth. I honor the mojani nerve, internet it's sent me a yeah. Kano. And no is yellowish in color. It's one I yang in no. And I see yang in a seno abano, penimudia abano. And no to me, and no a day color near the eba. You don't have a problem. So it's just bringing that kind of shade no to your teeth. And the ones that mothers were problem was the ones was not me banning if it a 2 year no. Setokro nim and I are anymore. It's fine. Just leave it. But that's nature. What is happening? But aesthetically, no, and I say, or drew baby, or not person or brightener. There's so many options, but not until say they were 18 and above, because 0 to 17, 18 is still considered as a child. And John gums it's not advisable. So that is the answer for it, because and yes, I will obia obo so a ne se achi nam ne tuntum enti ne se nankasa ye yellow but se achi nam ne tuntum no ntina e give it away man se ye white but yeah na entisa yeah na just like yellow but ne se achi nam ne tuntum no ntina e man se ye dey e fit away lucky on that side and yes gums no it is true and yeah there be an abia or habit of bad brushing and as a hardware or brushing and they pulling the gums away. One, the majority of the time, a massa a gums they pull it away from the tooth. No, that habit na modifier. And because already was saying, and you just make sure that the rest of them no and call sabium and I say bia or how I can be brown and for Emma. Two, said yang it me gray wrinkles no a sentence with mingini. And wounding no once and that government so air chique na a sin air but and that is also the time of it who be bizarre. And a gum disease a boss soon so a bit me the or how na the abro for your rebem I puff for ye quay ye finny free one who said say a sin and casano a corner chi have been a new gum no quachi. And I know so yes it's true. And see what my dentist and I'm so what bad habits are now what you know. We need sensitivity. Or see it's true, we need problem. And we need problem. But when we're injured, there's nothing we can do when the gum has pulled away. Ubit my baby, but and only advanced treatment, which is very expensive. And dentists don't want you to go through that pain and process and money for just a tiny worry. And see, Obaka said, "Oh, seen you." Now, our how it is a sensitivity. We have something there, friend, plastic filling, and I said plastic cover. You make me the filling be a very very tiny, like a nail varnish. Near that if I was in so, and you every 3 months or 4 months, nana 6 months. Near their first to say a baby sour how they feel, but my gums no, and bastra, and I say my sinning could simu when you yeah. And these are some of the things that a bit mama your gums can appear that and I say your teeth can appear. Yeah, and your friend gum recession. It's recession moment where you do recession, now it's either your habit of brushing or your age has given you away. Yeah.
Okay, I'm going to maybe will be the question we had to chat now. Say, please, can you recommend what we have to look for in toothpaste for good oral health? This will be me and also.
Yeah, very good question. Oral health toothpaste. Look for a toothpaste that has fluoride. Period. All the fluoride toothpaste no is supposed to protect your teeth from tooth decay and gum disease. And yeah, now we have measurements no between 1,350 to 1,500. Some toothpaste be abundance and crofebre at 2 when you go soon. If it is a charcoal toothpaste, no majority of the time any fluoride. And fluoride kind of content in a low. I won't recommend that for you. Make sure that obey you say no because I know what it's doing is a remove stain And I say, prepare a thin, a free, oh, I'm gonna buy your white. And it's all person will see if you think now to you. Okay, that's fine. Use that. But make sure it's what's out to another toothpaste with the Colgate or a Beeson so that all the brands know it was some measurements which have the fluoride content. So once a man 1,350 to 1,500 ppm. Yeah, part per million. Aloe vera, smoking, whining, and yeah, no more either say any fluoride, and I say the fluoride content is either below 1,000 or 1,000. And yes, so toothpaste with fluoride content should be something to look for.
Okay. Am I that say any presentation? Me pacho asembisane mo bia ni hobby.
But just a last question, and 9% big home. Wife, a year, 3 weeks postpartum. And so the 9% can be questions about what's the best way I'll be to an NHS appointment to save you a bit free treatment. Because as we are aware of, any difficult parts with NHS based, appointment. Because most of the appointment I'll be taking, as and when you full and I say I won't take on new patients. And so that can be more like best way and I say options are available in terms of trying to get an appointment.
Andrew, thank you. That's another good question. It's a problem which is not a problem, but it has become a problem. Before COVID, not any issue. You can just walk to any dental office to book your appointment and they'll book for you. But COVID, which is 5 years today, but as I still have Baba yet to say, the dentist for Trimudo, the government now in Sao, Ababe very, very difficult for anybody to get an appointment to see a dentist. And see what you can do, keep searching or area we want to enter the postcode, say yeah, dental office, and as a dental practice in my area, we use that postcode now. It'll bring the list. Every crowd would news would next door a dental office I can walk in. It'll bring all the list and then you start phoning them. They will tell you, but one of them could say, oh, bruh, when you use that what I will and I say, yeah, now you have a problem. No, we're in a problem, that's what they will call you, say, bruh. And then you can also use this number 111 emergency agents call, and then tell them, say you have a pain, and I say, this is what that number, when you call them, they're supposed to find you a dentist that moment. Into one say, search, they will search around and give you a number to call, a dental practice number to call so that you can go. But the problem with that, they are not going to take you as a patient. They are going to treat the problem. And a wife, a problem, say, yes, I'm no say, my funny around and pain or no source when him do na echo anything or the air manage it's a problem no honor fresh and number now. They will give you a practice to go, but they will only treat the problem for you.
Right.
Anything else, no. And to go crown out because me see me but where's okay on foul dentist was our attitude, on for because you only can be seen once. But majority of the time, so who receptionist now, me a very nice. Catching so a urgent treatment and buy, but me share some more vacancy and I say more taking new patient on. I want to register.
Yeah.
The thing about dentists, no better matter Bolton, now dentist or Manchester, it doesn't have a problem. As long as you can attend for your appointment, you are safe. These are the things I can tell you. Keep phoning around. It's not easy, meaning but some people are taking on patient. Just don't give up. Keep phoning. Keep phoning. But the problem over there, 111 should be able to help you.
That's right. Yeah, 111. Yeah, and an option I mean consider. And I'm speaking to receptionists. Yeah, another option I mean consider. That's something to look into. To me, that's
they are very nice. Some of the receptionists don't know, they know how the business is, and so you just go in as nice as you are and you greet them, smile. Actually, say, oh, when the problem in here, but what so we and now to what was now so don't have question. I don't mind me question, and the baby can get even registered. What's happening? The whole family know when you're dentist. But I will try and share rude one now. Okay, that's fine. That's your day. But don't give up. Now what's up? Another one. And then you just have to. But it's a problem when I one 111 wait my call. emergency urgent treatment. And then so on problem no, but it's a long wait. Wait ma ko hanopa. Wait ma be fia homachi. Because nipa omo person mo hwe no so ye dey. Also. And then on the chance of getting the dentist from there and so you're higher. Because or person ma hobby. It's almost a bit my taking board to look for a dentist for you. But again, it's 50-50. Do you want to go and spend your whole day in the emergency care and sign when you're dentist and I say you take it on board calling them? Say any day, I will leave it with you.
Brilliant. Thank you.
And sorry, before you go on, say your NHS dentist na a private there. You can go to a private offer or no but you and you miracle for no better. But if you want to have the government facility for
and that's the thing is that quality ones, no. Your friend is saying, I think it's last week, and I'm looking into it for private one be or Manchester City Centre. I don't know me a 24-hour care, but we already reviews now. Say any so quality one, and so I was wondering say what recommendations be an answer in terms of be a practice be a what Manchester based, and I say even like neighboring cities now more good ones a bit to me I come and I say.
I'm not in the practice anymore. I used to be in the practice that the church members can testify that I saw so many people.
Yeah.
It was so painful. Say, because we need to now me and my year. No, but I'm not in the practice anymore. I'm in a hospital. Hospital, you need a referral. And I'm not even in adult session. So when you refer about you might not see man as I can't even help. And maybe complicated, just it's my side there. I can't recommend. But reviews, let me tell you something about reviews when it comes to dentists. Anything about dentists is scary, from injection, from the filling, from the drilling, no. And it will be an experience. So maybe who as a dentist, maybe a warm injection, I think I know the way I'm a mind you, my boy, but you gave me a good service. But that's what it is. You can't control the pain. What charge me me man sometimes no, don't base on the reviews. It's not always correct. It's just nipano. The trust when you practice another particular dentist no, and the core and don't base, but because we are regulated, no, everyone has to cover the back. Meet me maltreatment, Sabe, you don't deserve. And I said, Minim say, soccer reporting, me and I can lose my license. I will always make sure I'm giving you the right treatment and you're paying for the right procedure.
Yeah.
So, but saying that, no, we are all there, no tea. You go see the experience, say you're private there, okay, now, wait my decide is I won't copy you. And your government dear wouldn't say free and but we try and within the practice you go no. Practice what they have about 4 or 5 dentists, hygienists, name them. Say, me na me sure na me who say who's a main service na you good at. Even though you're registered under me, no, you have the right to tell the receptionist, say, I don't want to see this dentist next time. Can you refer me to a different one? Within the practice now, they should be able to give you someone else to see. Me who I mean found what time it is within your right to do that. And you can also do that as well. Yeah. And I can't recommend, and then please don't base on the reviews, but just go see what you can do.
Yeah.
Private and studio, or better charge you any money or pay. That's the downside because government don't control us. It's independent job. Yeah, unfortunately. See, you have to.
I'm a say, but me did it. Only sentine say, menyanti as a personal ministry say ne Bible addition maso. And say be o aka so de kan ho betimi de account. And I know say nsem bisa bi ho betimi bisa. Emre ni see a yen kwa abonten kɔbɔka emfa yenum ho ahonidie ho no. Enu aba na ye crowd say de bi busa bia no. Obetimi akyerɛ nti mesrɛw. Wa asɛm bi how adwin bi obetimi abisa. Amans bibi won so betimi de account ama ya bra won kan ya betimi de account.
That's a lot I could say, but to me, we've had this session so many occasions. I could go on and on and on, but that is me. When it comes to teeth, non-stop, because I'm very passionate about what I do. But me pese meka nsem now to now. We've met a couple of times. What is your concern? What have you heard? And then now pese young it shouldn't be the topic that I brought. The topic I brought, it was just special. It as a person who experienced it, so that we can take it from there, and then no bit me your time no ABI buy, but a bit one so
I think
obviously no. Yeah.
I think that Sister Philippa, I'm an insasso.
Okay.
Madam, the floor is yours.
My question is if you go to a dentist, that dentist catch you say, oh, for instance, we saw the corner you clean your BC because or some tata be when they say one and say if you want home basically. But then you are told, oh, cause we could cleaning because back at home we usually tend to do that every year. But almost say, oh, baby, I knew so you don't need the cleaning. Oh, you are brushing well. But then later on, then they tell you say, Tokobi that will seem that needs filling. I'm asking, what is the cause? Because if you are telling me, say, me meeting ye all the time now, I feel Tokobi the demo, what causes that?
That's a very good question. Yes, indeed. We talk about tooth decay not long ago. Tooth decay, and yet one day in a developer, it takes months, years, and sign I show in your mouth. So sometimes it started like a tiny black spot. Then one your home area, now it digs into the tooth, and then it comes and become bigger. I feel you're feeling. And yes, we find out a lot of this, and we hear a lot of these problems. Sometimes you we a regular attendant to your local dentist. Yeah, check it here. We name the adults by numbers and the children teeth, which is the primary one, by letters. Into one said, say one sound, one this, one cavity. When you hear sound, the sound means it's okay, there's no problem. When you hear say, oh, premolar, and I say number 4 should be watched or monitored, there is something is of a concern, but and yet too much of a concern. And in your case, yes, who at the end says because tooth decay can be arrested. We can arrested estatia. Now jai there at the bayana, it's me disappear and I say a jai for from progressing. Into one says some moments what nani share because on himself trust to say what to 3 months visit regular 4 months 6 months 1 year. On himself by the time about next year no. Or shall I say enye kesi a esi ye hu bibi. Enti because I'm an ABI didn't take it or how or bedrelia manaya no beteki so much treat substance away to no enye mau into bejai. Enti ABI one call on regular maybe I later 1 year 2 years now what's happening I bigger. Now it's when you're whole and I say on monitor 3 months so by I can see was when you're whole one shop before but that is true but not who say a concern into 1 year and then 2 so could be says tata was someone now you're cleaner you who's a cavity because tata has covered tata started as plaque then it goes tata and it go and one is after the calculus or stone Enti akova esen no ye nche de hu how pa ni ye enti abra ko hygienist as dentist na yi hu ama no almost happen na ho na dey aba na obeka acho wo betmefu because wanye na dwuma yi and then 2 ebe when try x-ray 3 when try x-ray because x-ray and it show esen no ne tibia ankasa se calculus wo ho kra na se tokro da ho a bachelor say yes calculus but tokro bi da tokro no the question is a fele and I say you BB. And when you go and so with toothbrush it's not removing the tartar no like I said no demand it that dentist no so you no kwan na wo say one person na you obi a upia because it's a team no speak to the one or bookie one so receive you want to say what's no this dentist no who are concerned as one shop papa person who for and the front the command na for so kind the same my dear tiase because omu na ye adwuma ba that's ampa na ebia how no enche dan ye kese so ye o so ye mehu but he say but no ye ene ba ko ne nkoko na so one so ye obvious so one hu no ahwehwem say ye tokropa ba ignore no ignore he can complain them because omu complaint policy say sheets and paper. I want to complain about this. This is my problem, but nobody is paying attention to me. Moment they should give you, and then you can phone NHS the number and as a policy no. Then you may be given to someone else, or they will be penalized from what is happening to you. Yeah, meaning my answer question. Yeah, Philip.
Yeah, may I say mine was part of the X-ray part because the calculus and the now wasn't the problem, and it's not visible. But then I had a complaint somewhere in my teeth. Maybe I did. Maybe I'm crying up a whole me. That is the complaint I went to, and that has always been my issue. Apart from the sensitivity, which different toothpaste has helped. But when I went in, almost check here, everything is okay until the X-ray and the visual said there is tokro the baby, and I'm feeling, and obviously tokro in the baby for not maybe I'm missing no problem. So what is the issue? Because baby I'm said tokro I'm feeling, I didn't have anything there. It's only showed on the X-ray. They have filled it up. But what about the part where maybe I didn't? So if you can say something on that portion.
Okay. I said it earlier. Ntokrono, they say codentist no. Because you meet people, so me never seen how cry. I have never experienced pain. Not until you go to a dentist and I'll be who say you really have a pain or there's something wrong going on in your teeth or gums. And yes, sometimes no, the X-ray will show a cavity. Unya any symptoms. We have to treat it. We look at the size of the cavity. Yeah, unya symptoms doesn't mean that we don't have to treat because with time, no, you will have a problem. But sorry about that. But sir, the unya pain, say, it could be so many things. Besides, we get trauma from our toothbrushes. Which maybe unintentionally was toothbrush a bit more was sent and our gums no. A bit more chip. A bit must stay on and linger for some time and sign and no body no deal with it to reduce that pain. Two, it could be sensitivity. ABI, the exposure of the gum no is that big and that's what you are seeing. Or there is really infection going on underneath of your teeth. But X-ray is supposed to show any abscess or infection. So, and if they've done X-ray, they did not see any abscess, they did not see any infection, anything that give yourself a time. They will tell you, say, use minimum, say if your dentist has that, they will tell you to use via hot water and salt. With the ginger will know because and no baby the place no to reduce any discomforts for a week or two. No, but if you've done all of this, and yeah, go for the next step because if you're not sad dentist or no, but the baby to me, and sometimes it might not be or synchro, could be your jaw and a trigger, and as something else within the body and it radiated to your teeth. And I say, Emma, that response, they say, I will say. And don't be a difficult patient, but then also be firm with what you can also get from the dentist. Because in Prempino, me share difficult patient. Obey then I drink a dog on your crown. Or can be crutch and uncle try cry. And to see the balance where you can fit in na a year. Or 3 months time was our corner. Wait, my question, the problem is still there. Can someone see it? Can you refer me? It be I say, you have all this thing. Wait me, I can't. They're supposed to look after you for you to be well. And some of our toothpaste can also do a great job. You can just take a dab, rub it where you are having a sensitivity, the pain, and see carry on for days and see say beya na afi worry. I personally don't recommend mouthwash. By the time Rebecca said use mouthwash is when I know say you are having problem like you are mentioning, no. And then see cost of the mouthwash is about less than £5. You can use it. Then use it continuous for more than 2 weeks. And also could help reduce anything now we'll go through. We use no more than 2 weeks. We will sustain about was saying this so. Raymond question, I got you Raymond question but this color of teeth, now that's a teeth changing from white to yellow, no, could also be a Adriania Woody. Maybe a will help it. Sa India food, no, sa carry one, no, it means a sign of coffee, the tea, no, and it means a sign was saying color, yeah. Thank you.
I still have one more, but this one, any question more on the front of finding NHS dentist, I struggled through that for a few months until I finally I found out how to get it and me to me register the whole family in the long run. If you search for if you go on the internet and search find a dentist, NHS dentist, make sure you add say NHS dentist, you find it. They'll open a page where you put in your postcode. What the postcode in amount available NHS dentist around. Before I knew this, and I mean, say, oh, I'm around my friend called for the dentist, and I was struggling with. But when I had 111 phone, a train me saying, I mean, yes, sir, and some number to call. And me, yes, I find the dentist, I saw some different dentists, maybe I didn't even know they existed. Our page, so, and no, now me, one of them, and a PK. But I don't know, so no, sometimes they tell you they are full. Ask them, so, waiting list that. Catch on someone found to waiting list. Will be a befriend, be a mention, say, okay, NHS registration. If they are full, tell them to put you on a waiting list if they have it. And oh yeah, now I follow up once in a while. Then within that in Ubenya, oh ma, sometimes they tell you, say, oh, after they were opening for cry, tell them to add them on. So when you're honum cry for yourself, as far as when you're baby for somebody in the family or for crano, you have the chance of getting the other part. Like for instance, media and cranny in the long run, and then later on I'm then cranny when I'm here, so oh my man register hanum, can we register to as parents? And I'm on register, yeah. So please do that search. It will help you find the NHS dentist and also for you to register because it's important send a GP at the end of that's it.
That's a price. Wonderful contribution. I mean, Insha. I hope so. Andrew and wherever is looking for a dentist as well. Yeah.
Mama Weilla
that's it.
mpacho.
Okay. Pacho bi kasa.
Welcome to me ba.
Me pacho kasa.
Yo. Me pacho. Wosi subu na sa wokọ na womo fele ma wo na esan bu bie mu a. Wobɛyɛ ne dɛn me pacho. Ni omo fele na esan bu a. Wobɛyɛ ne dɛn. Wobɛsan
Good
akọ na ho.
question. Yes. The thing is, whatever you go to get, oh, yana, yeah, will be so, oh, mehano. No, it's within your rights. So either say utio or won't you, it's within your right. Won't you, and government is paying the person. What I say, would you, I'm saying, wow, sick and you need to, I said, wakoto atade was shop. Now, either say fit or unfit or the color you offer at you return it within the time now. What receipt is what the cockroach, and it is the same thing to your teeth. First attempt when you go to a dentist, that's what sense of boy. I did and say you're felon. You're showing the measurements, no, say be a saying no, say be a front ones, no, it be a edge kakrabi say any booye a felon. The thing about these front ones, no, in the feeling pa because a direct you peka say where you apple d ain't when you have a feeling dana a form more slow, which me saying yeah, that's not in a juma pa. But because of how we use it, no, and it's not bad weak, no, it's miserable. Ain't ebua just go back to them say ebu into ombeyamo. After maybe 1, 2, 3 of the same thing, no, while you're feeling ebu ye maybe 3 months later, oko or say you're feeling so yeah. Okay, hobby within 6 months. Her time now, is too short. And the next step of Ben say, instead of filling them, we have something we call it a crown. Crown apart for yes, and will be have a bed show. When I say a check, I said, if I say we're sitting in any bottle, and the tinny a check, and see, obey it is a crown, what is a tooth colored shape? Obedre no seno, obefare the kama to the anatomy of the tooth, no. Said or seno a shape retiana. No, yes, sir. Crown ama crown no the same day. Oh, good dentist, what be to say modern day technology media, obetima call and opa a bit mania was send kama. But sometimes it has to be sent to the lab. It may take 1 week. Ain't the lab no and the bay a send amount. You better take impression. Impression I to say I did be a grew or noom. Yeah, near was in a print so near the lab. Na lab na kwa crown near the ashamo. A bit me I stronger than the first stage, and I say first feeling na yema ono. Enti se esini bua ana bibia yema obia na or how about hono. And famo say a hona bahu 1 week later, a month later, 3 months later, a year later. Ubet me akosa dentist now. Why to me crana? Any dentist should be able to do it for you, but no besa jusika because then yet on the year initially. Enti pacho yes. Esin subua. Say I say bibia ye bia no or how about one sako. Ye beti my CC amo.
Thank you. Thank you.
Me pa cho asem bisa ne mo bia ne ho biem.
Me pato aka baako makai.
Me pa cho ka.
Sa wo akola na se ne sina esa time adi tutu no. Ntutu sa onsa nkwala ni bi wo ha musin tutu ntentem. Ebi so wo ha a eche pa. Na sa wokọ na sa dentist ne ka say okay wo ma ne da say won komra. Ya one sini ntutu a this omo de braces ho na se tini atutu sa ayedanyi o na se wo ka se wo mpe braces ne so a no wo atwe wo mo anu awo fam ana se time a sinu ape ene beba ebetutu ana se I was still baby teeth me pacha ebi a question ni make sense a betumi abo
It
am
makes a
kakra.
perfect sense. Common problem. Enya unkuna will face majority na efe. One, mami fan friendship. Will be dentist can be beer within your right no. What I was in a crime ye a kun. And who can be beer a kun. Near senior bema within your right you can say no. Obia onyesa watching and noise from because when I wouldn't name body now person the city. Oh how unsure. Because yeah the power and my patience said yours. That is very obiano. Esa with me a report no. And you have that power. In fact, when I say Ojina was saying a juma when you know why you know. Your body. Or cause say na yam na so umpa. On me enforce so enye bibia emma. Obemo the aqua say impo but time dentist ebe go against your will no. Yes, I did mean say a kum. And I say bit me a kum. Me few mayama ebia pregnancy said me call I know say I dear no yareno and yawu ebe ha kwalano. Yes, I can go and no make me defend me ho. Apart from I say bia epilepsy yare faint what I say a sinner pokoshe baby. I can make that decision for you. I say and yes I know bia and I say what can be bia. You should make a be and I said that is can be beach you should be able to say something. Oh, thank you, but me sorry, me fa. Inti obako won't you see from. Now the problem nini and kolano and I say yen no. A sin banning it to no edifa. By your be a friend of majority and I say normal. Say bia Philippa eba ketwano will be a 4 5 when you're in intem. How about me finding Joe Eba because me na who some Joe Joseph Akom and so banning ne eboso but ne say no e bien to yi and on chere say Philip Papa no in terms ni Joe banana say o wa modern say ban sana the development and also in chere so be perfect it and as it related e bit ma be catch up e say answer na be who say bia say ka x-ray wa han ka be show. Say enkwala de ne wono monum between 0 and 13 hona na ebi tutu na ebi behihim from 6 years ekon won say ebi tu na bia behim bi tu na bia behim sa say x-ray wo hona de chawa obon say enkwala de na wo anumu no empanifo de no esisi ase enti na yes scattered enti ana e friend mixed dentition because ke 22 year na ese we time panini de ne dey ebe hye honum. Some enquire be naturally and beautifully and uniquely. So the Yamiati aboying in ano. A single no man wohwɛ x-ray so a akwala de ne ɛwɔ hɔ but mpanifo de ne ensi ase onya sana naturally ɛbɛyɛ onya enti bo sa akwala de no go hɔ de ne de ne entu da ebe no replace penny de no obu also obetu na aye gap because penny de no dey anywhere. That is when the braces that kind comes in. And it's a tokro gap ne beda ho sa na. We can actually put the braces on me I think a slide be I can show you. Na a sitting in aba be close to sa gap no. So we have to make sure that the teeth are arranging in a very nice way and it's supposed to arrange. So a tutu I say tuna and two ya young for so say I say me oba be 2 months because before me make it that she says me 2 months. I say who say permanent one or what eba and I say we no on to or no na ebe gina work for ne kwa na nyina aha but time braces bebe mun say one me can gap on and I say you will be a friend of us e sini bi si ha de bi si ha ne bi si ha ha adoso akwara nanum akwara na bia onyini no ne jaws no narrow and ma accommodate all the number of teeth I see no and is and no it me to there AC tutu near the braces number near arrange no e also yen to be cry but braces can either widen the jaws or bring it closer na the esena be sisi baby say dey ACC but may say to na entu na say e bi ni ase a me make a decision say next in the next 6 months over na 2 year metu amount time me obetima kasa na dia ekeka na or twen nkwala mo pay injections ya na entan wo mo pa na ese ye2 and the advice is okwa kodiagro wiggle it na into and akrabo hon mo no so strong and obeka just in the next 6 months no so bana da so keka dia metu amount but say obetu amount no also making sure say one check x-ray crown or no admin sa obewu sempenifo de ne bi ebeba be replace no nti so dey otu nenya kwan ema ne ba but on to abra one year sure sempenifo de ne ba na say keka de a or every right sempenifo de ne kran makra de so otutu ema nti I've taken time to explain. I don't know if I've also explained it properly. Meaning, but that is what it is.
Medase Matias pa Yamisha. Nea wɔka no ɛno ano no Nyame nhyira wo. That's it.
Megiri sɛ yɛde adesua no bɛba awie wɔ ha ama yɛda wase ne adesua a wɔde ama yɛn. Menim sɛ biribi wɔ hɔ a yɛntumi amu sɛ yɛhyia wɔ nkyɛn mmiɛnsa ewie bɛbusa na wɔde ama yɛn. Nti mɛsrɛ sɛ deɛ yɛasua yɛmfa na yɛmfa nyɛ adwuma no bɛboa yɛn na apɔmuden ho hia ma yɛn yie. Mɛsrɛ sɛ ɛda Hansen wɔ ha a wɛbɔ mpaeɛ na ɔde yɛn nyinaa asi Nyankopɔn nsa sɛ na ɔtwerɛfoɔ asi mu nso ɔno ara nhwɛ yɛ so abra yɛkɔda ɔnhwɛ yɛ na so na ɔmfa yɛ nuabaa no si Nyankopɔn nsa sɛ da ne da nyina ɔma no ahoɔden a ɔfrɛ no ba a obɛtumi agye so no atoa so ayɛ sɛ adwumadi no ɛde ama nti ɛda Hansen sɛ akonya wɔ hɔ bɛtumi ne yɛ abɔ mpaeɛ.
Yɛda wase yɛn Nyankopɔn ne yɛaba nkɛseɛ. Yɛda wase paa Awurade adɔyɛ ne mmɔborɔhu a wode hu yɛn mmɔbɔ. Sɛ nnora yɛne wodi ntitimu Awurade nam wodɔ tumi so. Pikadere asafo wɔbɔ yɛn ho ban yɛne yɛadɔfo a kyitiri ne bɛnkyɛ ante atenkabɔ ne bia. Anwummerɛ yi nso wodi abɛdi ahyiamu sɛ berɛ a mpo yɛwɔ Awurade no ase bibibia yɛn ni da hɔ a yɛyɛ bɛboa yɛn nso honam fam yɛatumi ahwɛ nipadua yi so a ɛyɛ w'asɔredan yi ahwɛ ne yie a maahyɛ wɔ animuonyam no wonam w'aba a w'aso de ɛso adesua ma yɛn. Yɛsrɛ wo boa yɛn na afei kɔ so ma yɛn hunumu ne ɔmu ahotɔsoɔ na sɛ biribi wɔ hɔ nom a ɛni sɛ yɛde ka nipadua ma yɛkɔfa ha woba ɛnam wɔ Awurade asɛm so a honhom no mmoa yɛn ntumi nyɔ saa. Na berɛ nyinaa yɛtumi di nipadua yɛ a yɛde yɛbɛhyɛ wɔ animuonyam na ayɛ wɔn nsɛsoɔ nso. Yɛde w'aba a wahyɛ wo nsa. Nyansaboa kɔnyame nimdeɛ ti sɛ wɔ Awurade nkutoo na wode ma. Nti yɛsrɛ wo deɛ wɔasua yi na wɔde akyerɛkyerɛ ebi wɔ hɔ a Yehowa also the dom no said that for a free waba one who move for be free or radio on the maba. Fen coming and refa dom no my afe na modo to me so yesi na otu fufuro mo omobro hu abro mobro hu so nyina ni yachi rade boy ho ban na otu yi mu hwe ya di frɛ ni efi ba mu bibi bia bɛyɛ wɔ haw mu so abanyama ni nyasam de odi mu yɛsrɛ sɛ yie firi mu afe bua yɛn na yɛn kwana ɛne yana montu a yɛtu aba wo nkyɛn yɛn ho hia yɛn si yɛbɛhwɛ yɛn ho so na afe yɛabɔ yɛn ho ban fris mrato ne mpo bibi biara nsɛ mfata wɔ Awurade na mfa dimbɔ amɛka wɔ Awurade no wasafo anwummerɛ yɛsrɛ wo ɔdasuo yi mu bɛfa nsato yɛn so na ma yɛn apa na de pa kye yɛn a sa bɛdi ahyia mu abɛda wase ne wayɛ ama yɛn hyira nka wo din so yɛ mpaebɔ tiefoɔ na akɔ so yɛ yɛn Nyankopɔn yɛne da so a no nti so yɛ mu wɔbra yɛn ho ma asɛm wɔ Kristo din mu amen
Amen.
Amen.